Elizabeth. I'm an accessibility specialist in the Big Hack program at Scope. Scope is a disability charity campaigning for everyday equality. We listen to the challenges disabled people experience, and we provide practical information and emotional support when it's most needed. And we also campaign to create a fairer society. Today, I am going to talk about understanding disability in a digital society. I'll be looking at what disabled people want, attitudes, digital barriers, and the effect of the pandemic, as well as what we need to do as a society. Before we get started, I'm going to share a little bit about myself, my experience. I'm an upper body amputee from birth and a chronic migraine warrior. I have long brown curly hair and brown eyes, and I'm in my early 30s. My background is in content design with a specialism in accessibility. During my time at Scope, I've been able to learn more about the lived experiences of other disabled people and understand better the challenges that people face when engaging with online content. I've also created and delivered content accessibility training and given talks on disability, accessibility and assistive tech. I now work in the Big Hack program, where I am developing our accessibility training offer further and supporting our team with our resource library, which is full of articles and information on accessibility and inclusive design. The program also has a reporting tool for disabled people to share their online experiences and the barriers they face. So this helps us to crowdsource insights on digital accessibility and campaign for change in specific industries. So for example, we're currently looking at the accessibility of supermarket websites, particularly in a post-pandemic world. You can learn more about what we do at thebighack.org, and you will also find a summary article of this talk. So in the UK, there is around 14 million disabled people. So that's 1 in 5. 40% of households have at least one disabled person. So that's a considerable chunk of people that are often not able to access services and products or face barriers when trying to engage with organisations online. So what do disabled people want? Our research tells us that they want to be able to set and achieve goals and to be seen as more than their impairment. There are 3 main themes that are crucial to achieving this. Independence, so being in control of your life and your decisions. Confidence, having a sense of self-worth and the ability to set and achieve goals. And connectedness, so feeling that you have a role in society and you're able to make and maintain relationships. Looking at the last 8 months or so and the changes that we've experienced because of the COVID pandemic, disabled people's lives have shifted. For some, the changes may have been positive as digital technology and online interactions make it easier for them to stay connected and independent. For others, moving to a digital first society will have created many more barriers, despite access being more important than ever. In our research, we also identified 5 main aspects of life that are both enablers and barriers to disabled people living the life that they choose. Today, I'm going to talk about 2 of these: people's attitudes and being able to use and access digital technology. So let's talk about attitudes. I personally think that attitudes is most of the battle. Research shows that 60% underestimate how many disabled people there actually are. Why is that a problem? If a group is seen to be smaller than it is, attempts to remove barriers is seen as a niche concern. 32% think disabled people are not as productive as non-disabled people. And this has remained more than 30% since 2009. So attitudes haven't changed in more than 10 years. And finally, 13% hardly ever or never think of disabled people as the same as everyone else. So how disabled people are viewed negatively affects how our digital society views accessibility. Once attitudes and perceptions change, the rest will follow. So we really need to change this narrative and inspire transformation in everyone's attitudes towards disability, accessibility, and inclusive design. We need to stop thinking of disability as different and the few and start thinking of it as everywhere and everyone. We need it to be universal accessibility, not a disability minority. We need to be included as a core consumer group, and actually everyone benefits from it. So Elise Roy said that when we design for disability first, we often stumble upon solutions that are not only inclusive, but are also often better than when we design for the norm. For this to work, we need to close the digital divide and get what we're calling disability game changers to help influence, inspire, and revolutionize the next wave of digital innovation to be inclusive. We need organizations, politicians, and the public to challenge stigma and negative attitudes. We need action from all levels in society, and that includes everyone here today. So this brings me to the social model of disability. It is a way of viewing the world developed by disabled people. The model says that people are disabled by barriers in society and not by their impairment or condition. Barriers can be physical, like buildings not having accessible toilets, or they can be caused by people's attitudes, like assuming that disabled people can't do certain things, or that not considering or including disabled people at all. The social model helps us to recognize the external barriers that make life harder rather than making the impairment or the condition the barrier. Working together to remove these barriers creates equality and offers independence, choice, and control. To achieve this, everyone needs to understand this model and take on the responsibility of creating a more inclusive society. So let's look at access to digital products and services. Digital has, in many cases, transformed the lives of disabled people. New technology has been essential to breaking down and removing barriers across society. 78% of disabled people say that having access to digital technologies is helpful or very helpful. Unfortunately, as assistive and new technology provides access to the digital world, organizations create more barriers by not making their websites, products, or services accessible. So research found that disabled people are over 50% more likely to face barriers to accessing digital and online services than non-disabled people. A different study found that if you have an impairment, you are 3 times more likely not to have the skills to access devices and get online. During this pandemic, we're seeing just how big a problem this gap is. And it isn't just making sure that your website is compliant in terms of the Web Content Accessibility Guidelines. It's understanding how disabled people are accessing online services and content, both the barriers that they face and the context in which they are facing them. So for example, trying to access benefits in a panic state after losing your job while using a screen reader and struggling to understand what you need to do to apply, or not understanding how to use your device, or having a device that is out of memory and not knowing how to fix it so that you can send a photograph to your doctor. Or not being able to access your usual supermarket online, not knowing how to look for other ways to get food and essentials, or finding that other supermarket websites are inaccessible or you cannot afford the minimum spend. To get these insights, organizations really need to research and test with disabled people. So one participant shared his experience after losing work as a result of the pandemic. I would like to think my visual impairment doesn't affect my use of tech, but with universal credit, there is so much going on screen, which I do struggle to understand. Now that we've been forced into a digital first society, many disabled people are reliant on digital to access their healthcare services and benefits, to understand what they need to do to protect themselves, and to get the basic necessities to live through this pandemic. We know that 59% of all deaths involving COVID in England and Wales between March and July were disabled people. It is more important than ever that information is accessible and can be easily understood by the people who need it the most. We need senior stakeholders to take accessibility seriously and prioritize it to make sure that it is not only embedded in their working processes and culture, but that content creators, designers, and developers have the correct training, understanding, and attitude towards inclusive design. We need to put people at the center of the experience and integrate disabled people in the design and the content creation process. So we recently did some research into how disabled people were affected during the pandemic. When asked about digital technology, most participants described digital as important in supporting them to cope during the lockdown restrictions. However, participants with learning and behavioural impairments were the most likely to describe struggling as a result of the shift to online services. In particular, difficulties with social interactions being online and finding it hard to communicate and to be understood in this way. Others struggled with navigating new websites and technology, like using Zoom, digesting information, and completing online forms. Participants with physical, visual, or hearing impairments described experiencing physical accessibilities, such as struggling to participate in video calls with low quality sound. The pandemic also highlighted the importance of having clear and understandable information, something that I really feel is overlooked when it comes to thinking about accessible content and inclusive design. We asked respondents, in their opinion, how they found the communication and information provided during the pandemic. Of those who consider themselves a disabled person, 63% said the information is confusing, and 49% said communication is unclear. We also found that 47% of disabled respondents had experienced technological challenges during this pandemic. So how our society works has changed, and with it came a whole load of new barriers alongside the old ones. Many organisations, charities, public services were not ready for this change. Many were not accessible and continue to exclude disabled people by not making accessibility a priority. As a result, many disabled people have been forgotten and have not had the support they need when they needed it the most. So what can you do? It's not just about box ticking or consultation. It's involving and prioritizing disabled people's needs in the very core of the solution itself. We need people to look beyond their own barrier-free experience, engage with the barriers during the process, and then actively work to remove them in everything that they do. Accessibility wouldn't then be something that we need to do, often retrospectively, but something that is built into all practices and embedded in working and social culture. And to quote the Home Office, we are all temporarily not disabled. You will face these barriers. So the question is, when that happens, do you want to sit there cursing those who didn't take on the shared responsibility of making their service or product accessible? Or do you want to not even blink an eye at being able to do the thing that you want to do? I do appreciate that this is easier said than done. There can be some barriers to implementing accessibility, such as budget and time, but try to break them. Embed as many best practices as possible. Really importantly, do user research and testing with disabled people. Give people easy ways to tell you about the barriers that they're facing. Keep learning, iterating and improving, and make sure that you do have processes in place that make it easy for everyone to take on that responsibility and be confident with accessibility. Live and breathe accessibility in your work. It's everyone's responsibility, so be a game changer. Thank you.